Hi folks, I'm Dr. Ed Beyer. Today we're discussing one of the 22 ways our thyroid can become hypothyroid. One of the things I see every day in my office, and I've been in practice for 30 years, and I've seen thousands of patients, mostly female, that are just literally going crazy with their thyroid condition, or they're told they don't have a thyroid condition when they do. And there's just blogs and all kinds of stuff on the internet on this stuff. Well, I'm giving the straight facts. In the scientific literature, there's 22 ways thyroid can go low. Number 20 is thyroid resistance due to elevated cortisol. Now, what do I mean by thyroid resistance? This is a condition where the T3, the active form of the thyroid hormone, cannot get into the cell and do what it does because there's too much cortisol blocking it. It's like cortisol is like a bouncer, not allowing you into the nightclub, okay? And so there are many, many reasons for high cortisol then. So elevated cortisol is the arch enemy to thyroid function. It shuts down TSH production in the brain. It stops the conversion of inactive T4 over to the active T3, and it acts as a blocker of T3 from getting into the cells. So high cortisol is not a good thing. We have to look at this. This is an extremely common pattern that I see clinically in my female patients and some male patients. So now the causes of elevated cortisol, well, there's so many of them, and they vary from patient to patient, but they need to be tested for and addressed. And high cortisol is going to cause a lot of other symptoms too: weight gain, depression, memory loss, autoimmunity, inflammation, all kinds of different things. But the causes, an uncommon one I've only seen a couple times in 30 years, are tumors on the pituitary gland causing a condition known as Cushing's syndrome. A common one is people come to me using corticosteroids, either for an autoimmune condition or some inflammatory condition. Very, very common. So if someone's taking a corticosteroid, that's going to cause thyroid resistance. It's blocking T3 from getting into the cell. Anemias will cause stress to the adrenal glands and elevate cortisol. Inflammation will do it. Not sleeping properly, stress, over-exercising, overworking, fighting with your spouse chronically, okay? Alcohol, smoking, caffeine, sugar, all these are chemical stressors to our immune system. Recreational drugs, chronic infections, estrogen-dominant birth control pill, very common cause of cortisol elevation, nutritional deficiencies, blood sugar dysregulation, and chronic emotional stress. Proper testing is the key to identify what is driving your adrenal glands to produce too much cortisol. And remember, high cortisol shuts down the ability of T3 from getting into your cells. This is a very common pattern, folks. So if you know someone who's suffering from low thyroid function, this is a common one that I see. I'm Dr. Ed Beyer. I hope that helps. Have a great day.